my name is Jamie Krasnogor. I'm the intern coordinator for the Jacksonville Urban League Center for Advocacy and Social Justice. And tonight, I'm so thankful that Caroline and Mariana have invited our amazing guest speakers, Jane and Maureen, to speak about cancer screening and prevention. So without further ado, I'm going to turn it over to Caroline and Mariana to get us started on our town hall tonight.
All right, so today's town hall is going to be about cancer screening and prevention. Again, a special thanks to our speakers. Maureen here, she is a patient, an American Cancer Society Patient Support Strategic Partnerships Manager based here in Jacksonville, Florida. Has a Bachelor of Arts degree from Northeastern Illinois University and completed her MBA at Kaiser University. Maureen has also worked with the Girl Scouts of Gateway Council in Jacksonville and has been a volunteer for Duval County Public Schools. She's also been at the American Cancer Society for 8 years.
All right, and we also have Jane Smart joining us tonight. She's an American Cancer Society Patient Support Strategic Partnerships Manager based in North Carolina, and she graduated with her bachelor's from the University of Oklahoma and holds an MBA from Loyola Chicago. Jane has worked in many clinical settings serving cancer patients over the last 20 years and has worked for the American Cancer Society for 5 years.
All right, so now I'm going to turn it over to them. We'll have a Q&A session afterwards. So I'll let you all take it away from here. Just let me know when to switch the slide.
Well, thank you so much. Maureen and I truly appreciate being invited to talk on your live stream. And I want to say a happy Cancer Screening Week. I don't know if you knew it was Cancer Screening Week, and maybe this is all by design, but this is exactly the kind of stuff we're supposed to be doing right now. And so we're glad to share. So next slide, please. And so you know about us. Maureen McGuinn is the terrific Strategic Partners Manager right in Jacksonville. I am somebody in North Carolina that is a big fan of the Jacksonville area and visits as often as I can. It's a terrific place all around, Amelia Island, all that, Fernandina Beach. You guys are blessed in that area. So next slide, please. So the American Cancer Society, you've known about us. We've been around for a while, but just wanted to make sure that you know what our vision is. And that's to end cancer as we know it for everyone. And that comes in very important when it comes to the health equity for everyone, because it's exactly what we mean. And when we talk about improving the lives of people with cancer, helping their families get through it, we do it with advocacy, speaking for them, trying to get better policies for cancer patients and their families. We do it with research. No organization has given more, a nonprofit organization has given more to research. There's about 3 good-sized projects in my area I'd be glad to share about, but it's important work. Finding tomorrow's treatments, giving hope to more families, very important. And then patient support for the people that are in the fight right now. We do a lot, and we're going to share some of that with you. And we do that to make sure that everybody has a chance to prevent, detect, treat, and survive cancer. And tonight, we're not going to talk about it all, but we are going to talk a good bit about preventing and detecting, because that's so important. Next slide, please. And so here's some of the breakthrough things that have happened over our 100-year-plus organizational history. I'm just going to pick out one of these and talk about it. And that is, we were the ones that advocated for the warning label on cigarettes so that people would begin to know how dangerous they were. There was a time that people can smoke on planes, smoke in break rooms, smoke pretty much anywhere they wanted to. And those days are gone, and it's great. I am coming to you from Winston-Salem, North Carolina, which is the home of Reynolds Tobacco. Our nickname is Camel City. So tobacco is a very real thing where I'm coming to you from tonight. And so it's great to work for an organization that helps to mitigate the damage done by tobacco to so many people. Next slide. And so in prevention and early detection, the main concept I want to make sure everybody understands is that not all that long ago, maybe when I first started as a nurse quite a while ago, but still within my career, there were a lot of cancers that were considered death death sentences, you know, very, very scary. And certainly there are situations that people are in that are, you know, very serious. I'm not minimizing that at all. But what I would like to make sure that everybody understands is that when we catch cancer early now, many of our treatments are highly effective. So there's a huge difference between catching a cancer early and catching a cancer late. And so what we want to do is get people to treatment at a point in time where the treatments can do the most for them. And we want everybody to have that same access. So next. So here's the numbers. When you look over to the right, you're going to see that our best estimates for this year, which seem to be right, 2 million people, you know, 1.9 million plus new cases. That means more than 5,000 families every single day getting the call from the doctor saying, you know, I'm sorry, Jane, the biopsies come back, it's cancer, you're going to need to come in. You know, 5,000 people every single day get that call. So this is something very real that we're talking about that can really affect communities, because it's hard for the families to stay whole unless we can get them right back to their lives after treatment. So next. And so this is Cancer Screening Week. So we're supposed to be talking to, okay, so this is something we do with partners. So the American Cancer Society, we've generated a lot of work on our own, but we also work with partners all the time. So this one's like with Genentech, Stand Up to Cancer, Optum, and we work with public health folks on this initiative because we want people to be aware and taking action and learning more about their screening. So that link that you see, we'll be glad to share it with you. Make sure you have it after this. But that is something that these beautiful images of real people that have gone through treatment and, you know, go on to live their lives that are so important to their family. There's stories to be told about this. And we want people to tell this in communities. We want healthcare providers sharing this information, employers, insurers. When you go to that link, you may find that there's information on, where to get a free or low cost screening, how to prepare, where the location is. And this is for a lot of screening. So this is a very helpful link that you go right to, because it's going to be about screening for lung cancer, screening for breast cancer, screening for colon cancer, colorectal cancer, screening for cervical, prostate, skin. There's a lot of things that we know how to catch early, but people can't take advantage of it unless they know. Next slide. And so there's also other things, just out and out prevention. So what you see there on the slide about being physically active, I think being physically active is like the magic bullet for everything. It's good for our cardiovascular health. It's good to avoid dementia. It's good for osteoarthritis to diminish that, but it's also really good for cancer. So by keeping a normal weight, you can reduce your risk for colon cancer, for breast cancer. And that's important because you get to sidestep it entirely. So being physically active is good on so many levels. Healthy eating, so important. We have one researcher in this area that talks about the biome, what you eat. It might even have a generational benefit to the next generation to lower their cancer risk. So eating a healthy diet, having those healthy patterns, very important for your family. And then alcohol. You may have heard something about this, or you may not have. In the past, I don't remember hearing a lot about it. But as women, one alcoholic drink a day is where we should stop to not go into higher risk for some cancers. So, you know, 1. For men, 2. So as we go into the holiday season, just keep in mind that these are things to moderation. Next. And so smoking. We've seen some really good declines, consistent declines in cancer death because a lot of people have just put away their cigarettes. And certainly Florida has probably been the vanguard of getting that information out. So 30% of all cancer deaths are caused by cigarette smoking. So prevention. If we can get people to put their cigarettes down, 30% of all cancers, 5,000 people a day. It's a big number. But in addition, That 18% are diagnosed that have a combination of body weight, physical inactivity, the alcohol consumption I was telling you about, and then the poor nutrition. So when you add all that up, that's a lot of prevention to do without really, that might be within your control, something we can all work on, our goals. So next slide. So tobacco cessation. We have a new program. We've been doing like old programs for a long time. So if you've ever heard of the Great American Smokeout, that's ours. And we've been doing that for over 50 years. And that has helped an awful lot of people. But when there's, new times, you need new ways of doing it. So that Empowered to Quit is pretty cool. You just put your name in there. I put like Jane Smart in there, and then I put like my Gmail account in there, and then the day I want to quit. And then I'm going to get, that's all I have to do. It's free. It's American Cancer Society, and it's just online and easy. And then what's going to happen is I'm going to be sent a survey by email, and I'm going to tell them all the reasons I want to quit. And then I start getting messages when I'm ready to quit that gives me all the information I need in real time and links to help support it. And then in Florida, you go a little further. You have great access to maybe other things that have been shown to help by research. So you might be able to get nicotine replacement. You may have more resources to try and help people quit, because what we want people to do is try again, because it's really good for them if they can walk away from cigarettes, 30%. Next slide. And so cancer screenings. There's quite a few on here. Can you all see all those? All right. So back in the day when I was young, there used to be annual cervical cancer screens that might have started in high school or early college, and they were done every year. Now it's different. And why is that? We have a better test. So now we can look for the actual HPV strains that we know cause the cancer, and we don't do it as early because we don't want to give a test to somebody unless we know there's a benefit. So now the age to start for average risk, and average risk is important, not for people with symptoms, not for people with genetic histories, not for anybody with a concern or a problem, but for average risk. So start at 25. That's different than when I first started in nursing. It really is. And then in your 40s, lots of things to do. Start talking to your doctor if you're a female about breast cancer screening. By 45, yes, it's time. A cervical screening, keep it up on your schedule, depending on if it's every 1 year, every 3 years, every 5 years, depending on your results, to keep an eye on whatever you need to. Just keep tracking it. Colon cancer, that's dropped down to 45, and that's new. Also, all the stool tests that are available have made it more accessible to a lot of people. So colon cancer screening starting at 45 will save lives. And that's why the recommendation has dropped into the 40s. And then African Americans need to talk to their doctors, men, when they're about 45, about prostate cancer. It's a complex issue, prostate cancer, but people can sort through it with their primary care doctor to see if starting screening is right for you starting at age 45. And then into your 50s. Breast cancer screening, keep it up. Cervical screening, keep it up. Colon cancer, keep it up. Lung cancer, start. So in the past, there didn't used to be a low dose, so not too much radiation, a low dose CT that someone could take and find lung cancer early. It used to be that most all of the cancers that we found for lung cancer were late. And now we have a test. It's similar kind of to how a mammogram works, but it's for lung cancer. And it's no needles, has to be repeated every year, but it shows real promise. So that if you're somebody that has a lot of risk, has been smoking for a long time, or maybe just quit, it has a way of giving you a good shot if you're one of the people that's going to come up with lung cancer. And then prostate cancer, very important in your 50s to talk to your doctor about it. So all of these conversations, these are the things that help us stay safe and help us stay well and help us catch the disease as fast as possible so that our treatments, give real hope. We've got a message in here from Jamie about vaping. And I don't know if you've watched any of the shows that came along for cigarette smoking and how long it took to use the evidence in the Surgeon General and all of that. But it took years to be able to pull together all of the data that we have. And we've got a lot of data on tobacco. We're still building the vaping. So as soon as we know, because, you know, the ingredients, what may be in it, we'll have to put some real time and energy to let people know the safest way that they can proceed and what we know about vaping. So we always say to people who haven't started vaping, don't, because we don't know. But as soon as we know some things, we'll be glad to share. And I'm going to turn this over to Maureen. She may have lots more insights on any of these issues, but she's going to be terrific to show why, if we're going to do this for everyone, where health equity plays a major role for the American Cancer Society.
Absolutely, Jane. And that was a great question about vaping. And yes, we just don't have enough information yet, enough data to back up, and support research that might be coming out. I've seen a few articles, but not really much from ACS, but we are definitely working on it. So next slide, please. So I'm going to talk to you a little bit about health equity today. So health equity means that everyone has a fair and just opportunity to prevent, find, treat, and survive cancer. No one should be disadvantaged in their fight against cancer because of how much money they make, the color of their skin, their sexual orientation, their gender identity, their disability status, or where they live. Next slide, please. So we know that equity is different than equality. I think that this slide demonstrates why it's important to focus on equity and to ensure that everyone has a fair and just opportunity to receive that access to care, life-saving care, prevention, etc. So, we know that in order to achieve equity, the individuals and populations with the greatest needs and least resources require different, not equal effort. And those resources, should be there to help improve their health. Next slide, please. So just wanted to share some statistics that we pulled, for this presentation. So Black and Hispanic Latina women are less likely to be diagnosed at an early stage than non-Hispanic white women for all cancers. Next slide, please. And then nearly half, 48% of Hispanic and Latinx workers report having no paid time off from their jobs. This is an important one because a lot of the equity work that we've been doing across not only the United States, but here in Duval County, we've looked at things like, are there barriers to getting to screening appointments because of work schedules? Do clinics need to have hours that are available to people, before or after work? Or do we need a clinic specifically for, let's say, colorectal cancer screening to happen on a Saturday so that this patient population can make it in? So these are really important statistics for us to be able to share with the partners that we work with as well. Next slide. Breast cancer mortality has steadily declined over the last 4 decades, but not equally for all. We know that Black women have a 40% higher death rate than white women. Next slide, please. Triple negative breast cancers have poor prognosis than other subtypes. These cancers occur at twice the rate in Black women compared to white women in the United States. And then according to a recent Agency for Healthcare Research and Quality report, Black people receive worse medical care than white people in 76 of 190 measures, including elective treatment for breast cancers. We also know that most healthcare providers lack culturally competent education or training to address the needs of the LGBTQ+ patients. All of these things combined lead us to forming things like these roundtables. So a roundtable is a coalition of organizations dedicated to a shared vision of giving all people a fair and just opportunity to prevent and survive cancer. ACS roundtables are a recommended and proven model for creating sustained partnerships across diverse sectors and diverse communities to tackle both longstanding and emerging issues in cancer. And we recently just launched actually a National Breast Cancer Roundtable and a National Lung Cancer Roundtable, which is very exciting. We launched those at the White House in November, in addition to our already existing National Colorectal Cancer Roundtable, which Jane and I had an opportunity to attend last month in Baltimore. It was awesome. My first time being able to go. Lots of great presentations on equity and disparities and, figuring out how we can work as a community across the United States to push those numbers forward, to get more people screened and to reduce those late stage diagnosis rates. So that's what all 4 of those roundtables are going to have some focus area in addition to so many other amazing things. So there is an active link in this presentation that we'll provide after the meeting. So if you wanted to join any of those roundtables, it's just simple putting your email in and we'll send you updates as there are events happening. And then of course, if we have anything locally tied to any of those roundtables, we reach out to our partners to engage there as well. Next slide, please. All right, so Jane Smart and I are part of the patient support pillar at the American Cancer Society. So that means that we do a bunch of things, right? We work with hospital partners, which, in that instance, we work with administrators, with physician champions, with cancer programs across the continuum of care, right? So we also work with federally qualified health centers. A lot of that work is focused on screening initiatives, prevention and screening initiatives. And then we also work with some charity care partners. Ones that you might know of in Duval County would be We Care, Volunteers in Medicine, and our federally qualified health centers like Agape Health, Community Health. Next slide, please. So another thing that patient support does is, well, we support people who are in active treatment. And 2 ways that we do that are through what we call access to care initiatives, through lodging and transportation. And so our Hope Lodge, many people don't know about it, it's one of our best kept secrets, is complimentary lodging for people who are traveling for cancer treatment. So we currently have 31 lodges in the United States and Puerto Rico. We have one in Puerto Rico. And then we have one here in Jacksonville that opened in 2019, right before the pandemic. So we cut the ribbon in January, soft opening, grand opening, and then we were at full capacity in March and we had to shut down and relocate guests to safer locations while we made some adjustments to make things safer for people to return. Now, since returning and since opening, we have provided more than 13,000 nights here in Jacksonville alone. That's 515 guests served for an average of 14 nights provided per guest. We currently have 100% occupancy with a waiting list. So it is a huge need in Duval County. We have a lot of people that travel to Jacksonville for treatment. We have amazing world-class cancer treatment here from a variety of systems. People are traveling here for clinical trials. They're traveling here for proton therapy. They're traveling here for all of the things that we have to offer. And we want to be able to accommodate them and support them. It's very expensive to have cancer, but to have to travel for your treatment can really be a huge burden. And so if you think about the cost of those nights that we provided to those patients, it comes out to thousands and thousands of dollars in savings for those people who are already struggling, like I said, with that cancer diagnosis. Maybe they're not working as much as they were before because they're, dealing with their health. And so there are opportunities here to support the Hope Lodge. If anyone is interested, there are active links in this presentation for something we call Take Them a Meal. If you or your organization would like to host dinner at the Hope Lodge, there is a sign up. That link will take you to the sign up to do so. And then we also have an Amazon wish list. Because our lodge is free, we rely 100% on donations of supplies and things that are needed to keep the lodge running. The highest wish list items per our Hope Lodge manager, Michelle, are paper products. So paper towels, all the things that you would bring to school that teachers beg for on a regular basis. We need all of those things at the lodge as well. So please, if anyone would want to contribute to our Amazon wish list, we would be very grateful for that. Next slide, please. And then Road to Recovery is free transportation for anyone who is traveling to and from cancer-related appointments. It is a volunteer led program. We are actually actively recruiting in Duval and the surrounding counties, Nassau, Clay, Baker. If you or anyone that you know is retired or has just a little bit of time every day to give, not even every day, we have a web-based app. It's super easy to use. You can pick up as many rides as you want. You could do 1 ride a month if that's all that you can accommodate. But it is a huge need. As you know, in Duval County, the geography is very spread out. And so we have patients sometimes that need to travel 50 plus miles round trip to get to their treatment, and they might not have transportation. And so this is an amazing program, but we do still have an unmet need in our area. So if you wanted to share this with any of your friends, we would love to have more volunteers. Next slide, please. And then transportation and lodging grants, again, best kept secret. You know, we've awarded over $4.2 million in recent transportation and lodging grant funding to over 251 health systems across the United States. And this funding will alleviate the financial burden of transportation and lodging costs for cancer patients. It already has. In Duval County, since 2019, we funded more than $160,000 across a number of health systems here. So we do currently have health systems in Duval County that have transportation and lodging funds, and they work with those patients, their patient population, to identify the patients with the highest need and to get them connected to those programs. Next slide. And then some other resources for support. We have our 24/7 cancer helpline. That's 1-800-227-2345. We are available 24/7, 365. We have specialists standing by to answer questions, to provide resources. You know, if someone's up in the middle of the night, a caregiver, a patient, someone who's recently diagnosed and they just need somebody to talk to, we are there for them, and we will do our best to support them and to get them connected to resources that they might be in need of. And then our website, of course, cancer.org, so full of resources. I've been at ACS for 8 years. I find new things on cancer.org all the time. We have, you know, cancer A to Z, every cancer diagnosis you could think of, you could read about it. We are a trusted resource. You know, when people start Googling things that could get tricky and dangerous, you can always go to cancer.org and trust that what you're reading is factual, it's evidence-based. You know, everything that we do is based on research. So our publications are very trusted. Next, we have Extended Stay America, again, another lodging program. We have a national partnership. They provide complimentary and reduced rate lodging to patients. We do have some patients that might not be eligible to stay at a Hope Lodge. There might not be a Hope Lodge in their area, or they might not be eligible for a variety of other reasons. And so Extended Stay America, they really step in and support our patients in such an amazing way. They make them feel at home, and it's just a really great program. Again, it saves people a lot of money to be able to get that resource for free or a reduced rate when they're traveling during such a difficult time. And then we also have our Reach to Recovery, which is peer support for breast cancer patients who are newly diagnosed. We match them with a peer who had a similar diagnosis, a survivor who can, you know, share with them what their experience was like and just kind of walk them through what to expect and just be there for them. And the same for our Cancer Survivors Network. That is an online peer support community, and that's for all cancer types. Next slide, please. Research. So we are the top private funder of research, nonprofit funder of research, second only to the federal government. Next slide, please. In Florida, we have 18 grants totaling $13 million funding these health systems. Next slide. Happy to share that we do have a funded researcher here in Jacksonville, Dr. Verlene Justilian at the Mayo Clinic Center for Biomedical Discovery, and she's working on research in lung squamous cell carcinoma. Next slide. And then I just wanted to speak to partnership and how important it is because, you know, together with partners like you and with all of our amazing partners across the country, we've helped lead a 32% decline in US cancer mortality rates, translating to about 3.5 million fewer cancer deaths from 1991 to 2019. So we have more work to do, and, you know, we're just happy to have amazing partners in this fight. Next slide. And we'll open it up for questions.
I just, when Jane was speaking, thank you so much, first of all, that was fantastic. Jane was speaking on the generational aspect of when you're talking about food and nutrition and passing on those traits to generate. I was wondering if you could speak more to that as far as the generational effect of a cancer diagnosis.
Well, one of the things that Maureen was saying that's in the more than like 14-page website called cancer.org that has everything in the sun in it. We also have a podcast. It's called Theory Lab. And the researcher that did that particular project that was funded in her lab, she works in biomes. So what signaling do cancer tumors have beyond hormones? Because some people have triple negative breast cancer. They have different kinds of breast cancer. What can we learn about the environment that surrounds a tumor so that we can better control it and we can better, make the environment unfriendly for tumors, right? Basically. And how do we, reduce the risk in the first place? But her particular episode is called You Are What You Eat, or maybe What Your Mom Ate. And it's a really great one. I highly recommend it. It's like 20 minutes. It's great, but it will make you want to eat vegetables. It will make you want to do everything that we know is good for so many reasons, but also for cancer and maybe even for our kids, which is amazing to me.
That is amazing. I just wrote it down.
Yeah.
I'll give that a listen.
Give that a good listen.
Yeah, I will. Thank you.
Sure.
So unless we have any other questions, these are the questions Mariana and I have compiled just to kind of keep the conversation going. So what are some common concerns that individuals have about cancer screening?
Jane?
I don't know, Maureen. I think people are always a little confused about what their insurance pays for. I think they may not know that there's low cost or even free options that's not very well advertised. I think a lot of people are embarrassed to talk about what they don't know about. So it's very hard to ask for what it is that you don't know about. Like, just take, for example, like a stool kit that you see kind of on, television these days that you can get tested for colon cancer, by sending a box to your house or maybe, doing another different type of kit. Some of these conversations are embarrassing for people, so they don't have them. They don't have them with their family members. And it's very hard to get information without talking about something. I think a lot of people are, and Maureen, I'd be interested to see what you think. I think some people are confused about whether or not they need a test.
Yeah, I think that's true. I think there's just, in some cases, a general kind of just lack of knowledge. I think a lot of people, myself included, when we go to the doctor, we assume that we're having the conversations that we're supposed to be having. And if the cancer screening conversation doesn't come up, some people don't know to bring it up if it doesn't happen, right? Like, even if you're not due for a screening, it's good to still have that conversation, to initiate the conversation. Another one I think, Jane, that we can talk about is maybe we talked a little bit about stigma, but also just sometimes a mistrust or a misunderstanding of what procedures are like. People have heard that like somebody was injured, a relative had an injury while getting a mammogram, or it was uncomfortable, or you do hear things from people having colonoscopy. You do hear horror stories sometimes. Unfortunately, the negative stories are the ones that tend to get around when people are avoiding something. And so I think just being able to normalize those conversations and give people the tools to say, what, I had a mammogram and that wasn't my experience, and maybe that person was that 20 years ago, the technology has changed and all those things, so those are
true.
It's
true. I don't know if I've told anybody that I chose to have a colonoscopy instead of doing a stool kit because I wanted 10 years off, and that's what I like. I like not having to think about it for 10 years. And that's my value. But other people might say, no, I don't want to. I don't have the PTO. I can't take the time off. And then that's a real thing. And if you don't know you have these options, you don't know.
Or you don't have transportation. That's another one, that's a big barrier to care. If people don't have transportation, you need a ride to and from a colonoscopy if you've been sedated. If you don't have that, that's a barrier. That's a problem, so.
It's true. And someone to come with you. And if no one's told you all of this is in advance, it's a bad surprise.
Yeah, right.
Thank you. Those were all really good points that are not talked about enough. And I have noticed myself and people around me too. All right. Our next question is, what are some preventive measures that we can all take to live a healthy life? You guys kind of talked about this a little bit.
That was one of my slides, but, so exercise is just terrific for all of us. Me, as I'm getting older, I'm a little bit more encouraged to do these things because I'd like to stay well as long as possible. And the more that you get towards an age, where these things can happen to you, it becomes very real. So, for me to want to exercise the 150 to 300 minutes a week, that's a real goal for me to set out. That means that like 3 times a week, I got to walk 3 miles or something at a pretty good clip. And I don't always do that, but I would reduce my breast cancer rate if my risk if I did do that. And I know that. So it's really one of my goals. We can vaccinate kids. There's a vaccination to prevent 6 different types of cancer. And at middle school, we recommend it before they ever have a chance of running into HPV. And so it's amazing to me that we now have a vaccination against cancer. I guess we have a vaccination against 2 when you count hepatitis B also. But every time we have one of these breakthroughs where we can just protect children so that when they grow older and become adults, they don't have to deal with it. It's just amazing. And then, if people smoke, give cessation another try. I don't know, Maureen, am I leaving off anything to lead a healthy life?
No, I think people just maybe need like pointers and tips, which there are tons of those on cancer.org if you go to look under the prevention tab. So many different things that you can do, and apps that you can download to hold you accountable and
Cookbooks.
you a little bit for physical activity, maybe tracking your diet, etc. Lots of great resources.
Very true.
Absolutely. We have another question in the chat. Do you think there should be more screening around age 25?
That's a tricky one. I saw that, and I was thinking about that a little bit. I think there would need to be some evidence for, depending on which cancer we're talking about, there would need to be some evidence for that to change that recommendation. I think you're probably, correct me if I'm wrong, I think you're thinking that we're seeing younger people being diagnosed, with cancers. And certainly when that happens, that's why we changed our colorectal cancer guideline. We started seeing a larger, we saw an increase in late stage diagnosis amongst younger people. And so we were able, based on that information and with a lot of partner organizations, it's not easy to change a guideline. We can change it, but that doesn't mean everyone else is going to follow suit. So it's taken, since we changed it, Jane, at least 4 more years for the guideline to be changed to where insurance companies will now pay for it. Changing a guideline is very challenging, I guess, to my point. And it doesn't happen overnight, but if there were evidence to suggest that some cancers, there would be benefit to starting around that age, then yes, I could see that happening eventually. We start seeing that colorectal cancer 45 is not young enough, we will definitely, if the research shows it's not young enough, then we'll continue to go younger until we found the right spot.
That's so true. We track and support understanding all the new cases that are coming through, as many as possible through the United States. So we've been doing that for years. So we really do have a good understanding of what's happening. So we've talked a lot about the modifiable things we can do to be healthier, but the one thing that we can't do a thing about is age. And that's the number one risk factor for cancer. So a colorectal cancer average age is 66, even though there are younger cases that we're going to try and find so that they had the best outcome. We still, and really thankfully, only 1% of cancers are in pediatric cases, and age is the one thing that we can't fix, but we can try and be as well as we can and keep our healthy cells well and age well if we can.
Absolutely. Our next question, what are the challenges in your community around cancer prevention and screening? So challenges to getting screening.
Well, I can speak to that here in Duval County. Definitely transportation, that information, that education, patient education, understanding when you need to be screened. There's an access issue with insurance. People who are uninsured, underinsured, like Jane spoke to earlier, maybe they don't realize that there's a free or low cost way to get that screening done. They don't realize they can get cervical and breast cancer screening for free in Duval County if they are uninsured. There are programs that can help them. There are programs that will help if you don't have insurance. We Care is an amazing resource here in our community that will help connect you to cancer screening if you need it, to medical care. I mean, these issues are kind of similar everywhere. They're just, maybe more opportunity in some areas to improve.
There's a question in the chat, says, has the Ready Ride system removed any transportation barriers?
So Road to Recovery, our transportation program, is only for people who are in active treatment. We've talked about, a lot of people have said, could we use it for screening? It's something that I think, people have looked at. We currently do not have any transportation support for people who are getting to cancer prevention and screening appointments. It's only for people who are in treatment.
And if we were ever able to get enough volunteers that every request that we got for treatment had a ride and a driver, I'm sure that we'd look into doing more for people who have not yet been diagnosed. But right now, our focus has to be the people that are trying to get to treatment.
Yeah.
Our next question is, what are the greatest socioeconomic barriers to regular cancer screening? What about other barriers? So it's like a two-part question, I guess.
Mm-hmm. We talked about one with the colonoscopy, having a ride, having a caregiver, even with that one, being able to do the prep. If there's a copay of some sort associated with the procedure, that could be a deterrent. Or if people think there's a copay associated with the procedure, there actually isn't a copay for, and they don't know that, they might avoid the appointment. If somebody thinks they have to pay $50 to get a mammogram and they need groceries and gas that night, there's a decision that has to be made, so those are some of the issues that a lot of people face. Transportation, maybe they don't live close to a place where they can get screened. Maybe they live here in our area, in Baker County or in Nassau County, in a more rural area, and they can't get to an area where they have access to those things. So,
Maureen, I was really struck by when you were talking about how many people don't have PTO, can't get off, because it's very hard to risk your employment by, or your rent check to take time off to take care of yourself, particularly when there's so many competing things. So a lot of things can stand in the way. And how many times do you think people are going to a doctor if they've got real socioeconomic deficits? They may not be going to a doctor unless they really, really need it. And then that's hard to talk about prevention whenever you've got this other problem that you really, really need to see a doctor for. So it might really space out when those conversations are taking place.
I just thought about something when you were talking to, for people who have children, they might put off their care because they have had to use whatever time off they can get to take their kids. They've had to miss work to take care of their children who were sick. And then when it comes time for themselves, they just don't have the resources left or available. That's childcare is another one that we talk about. How can somebody get a colonoscopy if they have children with them? Well, they can't, so like in that case, should we start discussing a stool-based test for that person to take at home? That's probably a better intervention for somebody who doesn't have access to childcare, et cetera, so those are all the things that our partners are all working on these things and looking at ways to make things better and to increase those rates. So
it's a lot of factors that go into it. It makes it tricky. Absolutely.
There's a whole lot of things that can stand in the way. That's exactly right. It's not one thing.
Yeah. And when they're all on top of each other, it just compounds the issue. And that's why we have people like you doing great work. So thank you both for everything you do. And thank you for joining us this evening. I didn't know if we had any other questions, but you both were fantastic and we appreciate your time.
Well, thank you for letting us come on Cancer Screening Week. This is exactly
this worked out great.
Like we planned it, and we'll send you all of the resources so you can get those.
Please do.
Participants. Thank you.
Well, if there are no other questions, I just want to thank Caroline and Mariana for getting our guest speakers on tonight, especially during Cancer Screening and Prevention Week. The more you know. And then thank you again, Jane and Maureen, for coming on and joining us tonight. I know everybody who's watching in the future will learn something because I know I definitely did. So thank you again. And we look forward to having more conversations about how we can share more information about cancer screening and prevention. So thank you on behalf of the Jacksonville Urban League and its Center for Advocacy and Social Justice. And I hope you all have a wonderful holiday.